All right. So, what to expect from in practice education and supervision? So, the GP Reg and supervisor relationship is one of the most core relationships in general practice training. Your supervisor is your go to person in the practice. They're the person you approach for any questions about clinical side of issues, training side of issues, always be directed with the college, but your key in practice informant. You should always know how to contact your supervisor. They should be easily accessible within work hours. If they're not in the clinic physically, you need to know what the protocol is. So, do they want you to call them, or is there a dedicated in person doctor that they'd like you to speak to instead? After hours, it's also important to clarify if you need to, how to contact them then and in what circumstances they would consider this appropriate. Especially when starting GPT-1, you should be chatting about most of your patients with your supervisor, but having this discussion up front about when to call for help and how to call for help is really important to clarify so everyone's on the same page. As a GP Reg, you also have protected teaching time with your supervisor. The amount of this will depend on your stage in training and your college training provider. Education should be tailored to you. So, looking at your learning needs, what you need to get out of these sessions. So, you may also have an agenda to chat through with your supervisor. But similarly, you can't always know what you need to know. So your supervisor may also have really important topics to discuss with you about GP training or approaches to things in general practice that are also important to learn. Under the NTCR, AGPT registrars are also mandated to attend their official teaching out of practice, and they must be paid at their base rate to attend this. Check out the educational release clauses in the NTCR for further information. And as always, there's GPRA's website for you to refer to.